record this meeting. And we will make the recording and also the slides available on our website. And if we can capture all of your email addresses, we'll send you the links to those things. What we want to talk about today is the impact that COVID-19 is having on local Michigan communities. And I want to do just a little talking and then kind of get out of the way so you guys can share. What I find is that when you start putting your minds together, you really come up with the strategies and approaches that we need to be having. The health department is not, alone in addressing this crisis that we're in. And again, thank you so much for all of the work that you've been doing. We've often felt overwhelmed and have had to reach out to you for help, and you've really helped us figure this thing out. The main thing that's motivating me to have this meeting is that, we at the health department are really experiencing, sort of a state of being overwhelmed and unable to discharge all of our responsibilities to the community. We hear the same thing from some of you, and we feel a responsibility to tell you that instead of soldiering on and putting on a happy face. What you hear from the state all the time, they say, oh, if you have a question or if you have a problem, just contact your local health department. And what we're aware of right now is so many of those calls are going unanswered and unreturned. And we're experiencing the same thing sometimes when we reach out to you. You're really, really busy with things that are hitting you. And so we just need to be honest about that. The governor has done a lot of things, some of which I really approve of a lot. She's really shared a ton of information with the community, but so far she has not said to you, the public health system is in a state of crisis and is not able to meet the current challenge. And I feel like that's something that in a crisis is one of the things that I'm trained to do in emergency response is tell the truth to the community. So we're going to cover 5 things today. We're going to quickly review data on the COVID increases in Michigan. Some of you've seen our slides, so I will go through that relatively quickly, but I know some of you have not seen them, and I really want you to get a good look at what's happening. And that will include local data, so you'll see what's happening in our 3 counties locally. Then I want to talk about the causes of the increase. It's very important to understand what's driving this. People have a lot of concerns about certain things, and I want to put have us see clearly what is driving this thing, so that can help us think about responding. I'm going to talk about likely state and local responses to the current situation. So what should we expect to happen from the public health system? I'm going to talk about the impact of these increases in COVID on the health department in particular, what it means for us. I'm going to cite examples of impacts on some of your organizations. And when we get into the question and answer period, I'll be interested in hearing stories from you that I know I don't know about. I'm always surprised when somebody tells me what's really going on out there. Unless somebody tells me something, I don't know it. And there's so much information, it's hard to keep up. And then finally, I want to talk about, I have some ideas about how we could and should respond to the next phase of this pandemic, sort of between now and when the vaccine arrives. And then we'll just open up and have questions and discussion. I have a press conference at 10:30, so I need a little break before that. So we'll probably go a little less than 90 minutes. So let's start. So does anyone have any questions before I get started? Just about, okay. I will then share my screen with you. And let's see if this thing is actually advancing. And it does not seem to be. So I'm gonna Stop it. And start again. See if I can get it to work. Okay, let's see if it's working now. Yes, it is. So what you have on the screen in front of you here is a chart with the COVID cases per day per million population. And there's Michigan sort of in the orange or red. And this goes all the way back to March, to the beginning of the pandemic. And I want you to notice the spike all the way over on the left in cases, which seemed so horrible at the time it was happening. We had hospitals in southeastern Michigan that were overloaded. People were being treated on the floor of the hospital. There weren't enough beds. It was a terrible, terrible thing. Look at how small that hump in March is compared to where we are now. Basically, what's happened is COVID is not concentrated in Southeast Michigan anymore. It's spread out all across the state. We're actually having in some parts of rural Michigan right now, COVID rates that are higher than in urban areas. Think of the UP, they're having very high rates of COVID in what's more rural than the UP. It's getting up near 600 cases per day per million. I think you probably heard yesterday, there were 6,000 cases. So if we have 10 million people, take 600 times 10, you get 6,000, right? So the arithmetic works out. How bad can it get? Well, if you look across Lake Michigan to Wisconsin, their rates are twice as high as ours, and they've been there for a while, and they're still going higher. So my basic message here is we just don't know where the ceiling is and how bad it can get. So these are the hospitalizations that are happening. And of course, we had a lot of hospitalizations at the beginning, then it came way down. Part of the reason for that is we started learning how to take care of people before they were hospitalized to keep them from getting bad, or when they were hospitalized, we could get them fixed up quicker so they were getting out, so they weren't in the hospital all the time. And now it's peaking back up again. And that's just because of the increase in cases. If 5% of the people who are ever sick with COVID wind up in the hospital, then as you double your cases, you're doubling the number of people in the hospital with COVID. If you triple it, you're tripling the hospitalized people. Yesterday, this number, I didn't change the graph, it was near 4,000. So it's already, basically the U is already completed on the right-hand side. I just didn't have time to update the data. The last thing I'll show you is the mortality rate. Of course, we had awful COVID mortality, especially in southeastern Michigan at the beginning, because we didn't know how to treat people. We didn't know what to do with them. And then it came way down as we did our shelter in place, stay at home order. So COVID kind of went away. This is the deaths. So there were much, much fewer deaths. And really, you know, in July, it was kind of safe to go out again. There wasn't that much COVID. And then the deaths have started to increase again. And that's because of the increase in cases. And we're just seeing again that rule sort of, if 1% of the people who ever get COVID die from it, if you double your number of cases, now you're at 2%. If you double it again, now you're at 4%. And we're getting near, 4 per million, and now we're getting near 6 per million. So, you know, if we're at, by the time we get up to 8, yeah. So, you know, we're getting to the point where we're having, you know, a death per day for every county in Michigan. This is the local data for the Mid-Michigan District Health Department, not broken out by county. It only goes back to August, and it's really just so you can zoom in on this exponential increase that you see here. These data are in our contact tracing system. It's connected to the Michigan Disease Surveillance System, and it's called TraceForce. It's what we use to do contact tracing. So this is raw, local data that our disease control nurses are working on. These numbers are going to be different for our counties than what you'd see on the state website because they aren't processed yet. We aren't sure every one of these cases is a mid-Michigan case. There are cases in other counties that have yet to come to us. Some of these people turn out not to be cases. We find other cases somewhere else. So the numbers are still being processed. But this is a measure of the work that's hitting us every day, and it's increasing exponentially. For every one of these cases, we have 3 or 10 or 50 contacts that we have to trace. And so it's just a ton of work. And at this point, we know that we are days behind in some of these cases. We try to prioritize, schools, people who are at risk, vulnerable people. We try to zoom in on big outbreaks so we can catch up with people who are spreading it really quickly. So some people who aren't high priority cases aren't getting called right away, even though we know they've been exposed to COVID, because we can't. How horrible is that to think about? That's where we are. That's why I'm sharing this information with you. And then this is the same information broken out by county. Clinton is in blue, Gratiot is in green, Montcalm is in red, and this goes all the way back to the beginning, back to March. Here you see little humps as we go through the year. These seemed like towering mountains of cases. They were so many. We couldn't, it was just awful for us. Now look at what's happened. This is, we never thought we'd be here as these cases zoomed up. You can see that in the beginning, it was mostly Clinton. It gradually rolled north from our nearest metro area in Lansing, but now it's in all 3 counties. We have red, green, and blue in equal proportion. So it's everywhere in our community, and it's everywhere in the state. There's no place that's being sheltered from this right now. So I'm going to switch directions now, and I'm going to start talking about the causes, and then talk about the health department responses, and then the impact on our functionality. So the main cause of this spread is one thing. It is unsafe gatherings. It's people who are getting together in groups, mostly indoors, without masks and without social distancing. And when we have meetings every morning with our team, and I ask them, what are you seeing out there? Oh, I wish we could take our data and crunch it and do an epidemiological analysis. No, I don't have that for you, because we've got all hands on deck with contact tracing, testing, getting personal protective equipment out to partners. We're not stopping. And for me to be Dr. Fauci and do some kind of a complicated analysis of the data, just verbally when we share our experiences and talk about the big outbreaks, it's coming from these unsafe gatherings. So it's weddings, funerals, church services, things like that is where we see these explosions of cases. And this is really poignant for us. So, I mean, for me, I'm a member of a church. Nothing is more nourishing to my soul than to be with the people I love. Month after month after month, I can't do that anymore. Who doesn't want to celebrate a wedding? Who doesn't want to grieve a funeral? People are doing these things, and sometimes they're doing it defiantly, and they're talking about how COVID is fake and all of that. And sometimes they're just doing it because they're human beings and they do it. But this is how it's being driven. And it happens within families. It is so hard for our vulnerable families, once one member gets it, to keep it from spreading to the rest of the family. So a family of 6 or 7 people in an average sized home, they don't have a place where one person can go and not breathe the same air as everybody else. And then you'll see, 4 of the 6 have it, and now 1 is in the hospital. So we just watch those things happen, and we feel helpless to stop that spread. So I want to give examples of things that aren't driving it that people think maybe are. And the best example is schools. So much in the media, we're hearing schools, schools, schools. And you can go on websites and see data about school outbreaks and things like that. But really, only 5% of our cases are connected to schools. And most of those are not as a result of spread in school. There are people who got COVID back in the community where at unsafe gatherings, because they're human beings, and then they come to work or they come to school because their parents have to work and don't screen them properly. The kids come to school anyway, And then they develop symptoms and we find out they're a case, and then we have to quarantine 20 or 30 or 50 people in a school who were exposed to that person. The problem for the schools is the quarantines. The schools are shutting down because they don't have enough students or faculty or staff to run the school, not because they're overwhelmed with sick people. So we wish everyone would act like school. We wish everyone would have a masking rule and a social distancing rule and would change, their cafeteria so people aren't eating together in groups and do all of those things. And if all of our mid-Michigan businesses and other employers were doing that, we would really, that would make a huge dent in it. Some businesses are being fantastic. We could make a little video about them and use them as a teaching tool. But we do have others that are not, and we're having outbreaks in those businesses. So schools is an example of where it's not spreading. Places where they generally where they have COVID rules and they're following those rules are safer. One question we get, especially from the schools, because the quarantines are so punishing for them. When they have people on quarantine and they can't continue to operate, do we really have to quarantine? And I'm waiting and I'm praying for the CDC to say, okay, the quarantine is not 14 days anymore. Now it's only 9. And then maybe we can get them down to 6. And this can be easier. But that shoe's not dropping. We're not hearing the quarantine time being reduced. It would be a lot easier if quarantine was shorter. About 10% of the people who we quarantine turn positive. So that's a lot of potential spread. If we weren't quarantining, there'd be a lot more cases out there. So for schools and businesses, it is definitely worth it to quarantine people because you're keeping sick people from being in your facility and spreading the disease. So I'm going to change direction now and talk about likely responses. So this Supreme Court decision was a big blow to Michigan's response to COVID. And I don't know about the law regarding, whether that 1945 emergency powers law was really constitutional or not. Maybe the court made a valid legal decision, but the impact of it was to make a certain percentage of our population think there was no more public health emergency powers at all. And how do we know this? We know this because when we talk to them, when we tell them they have to quarantine, they say, I don't have to quarantine. The Supreme Court took that away. Or when we're doing contact tracing and we're talking to someone who we know is sick and knows other people who are potentially sick and the disease is spreading, they say, well, I don't have to talk to you. And sometimes they won't. They'll just hang up and they won't talk to us. And when we're dealing with businesses that aren't following safe COVID practices, they'll say, you have no authority. The reality is public health powers have not gone away at all. The public health code is still in force. It was a narrow law that just focused on that emergency power law, a narrow ruling that just focused on the emergency power law. It didn't take away, public health. But it's really made it hard for us to work with the community. So now state and local public health, looking at that exponential increase that I showed you, we know that we have to change behavior. We know that that's just going to keep going up and up and up unless we can get some kind of behavior change. And if we can't get compliance from people, then we're going to have to look at, we're talking about, should we be doing additional orders? We know that the state is very much back on its heels and thinks that whatever they do now will cause widespread disobedience and criticism. And so they are really being tentative about coming forth with plans and proposals to get the kind of behavior change we need. So then it falls to local public health. And I get asked every day by the media, are you going to do a local order? Well, we have the same problem. If we do a local order, how do we get compliance? How do we get people to say, well, the state's not ordering that, why are you? We have different communities with different politics, different problems, different willingness to deal with this pandemic. So we're so worried about winding up with 45 different sets of local orders that are confusing. If I'm in Newaygo County, I can do one thing, but if I drive over to Howard City and I'm in Montcalm County, I can't do it, and uh, it could be a mess. It could be a real enforcement mess. And so what I'm saying is, this is why we're having this conversation, because we might have to work together at a local level to respond to this thing, because the health department does not think that a local order from us will lead to the kind of behavior change we need. If we do it, we will do it in partnership with others, and that will take time in politics. And what we really want is a statewide response. And where do we find, after these setbacks, where do we find the political will to go forward? I'm just being honest here, so you know what I'm hearing when I talk to the governor's office and Michigan Department of Health and Human Services. So what have been the impact on services? So I've already talked about the impact on local public health. The fact that it's very difficult. I'm going to use more candid language. It's one thing to say, well, we're late returning phone calls. It's another to use the word promises and say, we're having a hard time keeping our promises to you. Because, for example, our agreements with schools, that if you have a school case, we're going to call you within 24 hours. That's a promise between community partners. And that now we're not able to do that. There are a lot of other things that we're aware of that are going wrong with the system. I showed you local data and it looked harrowing. And it was some kind of a measure of the overwhelming work that we're doing. Well, we know this data systems are broken right now. We know that hospital laboratory information systems that should be feeding us information on positive COVID cases are jammed up, and they aren't dumping into the Michigan Disease Surveillance System to come to us. We now have an explosion of rapid tests that providers are doing across the community. There's no electronic reporting for that. They have to do manual data entry, and they're overwhelmed with stacks of paper results from the rapid tests, and they can't get them into the system. We're even helping some local clinics. We're doing, on top of everything else we're doing, we have people doing manual data entry of paper data. Okay, so I'm just letting you know the truth is, every day you get a briefing from the state or from your local health department. There's this many cases, there's that many cases, et cetera, et cetera. Well, that's what we know about. What we also know is that the data systems are broken, and we're moving into an area with less and less accurate information as the problem becomes more and more serious. For those of you who are trained, in incident command or national incident management system, part of what we talk about is this sort of fog of war. If the storm surge that hits the town takes out the emergency operations center and the police department and the road commission, so the trucks can't get out to help people, it gets really bad. And we're starting to enter a period like that. So the last thing I want to talk about, and honestly, this is just coming from Marcus Cheatham. I looked to national sources of information for ideas about how to respond to this next phase, and I found very little. I looked to local sources of information. Terry Legg, for example, sent out that wonderful stuff about how to talk about the election. We have state and local experts, and we have local experts. But what I finally wound up doing is just talking about our local experience based on what I'm hearing and seeing. And what I really want to do after this slide is just open it up and have a conversation among ourselves. But one thing I know is we're going to run into challenges that we've never had to deal with before. You're going to be tasked to responding to things that you say to yourself, I can't respond to this because I'm not trained. I don't have people who know this, right? I've never done this before. So if I try to do it, I'm going to do it badly. Please, someone take this away from me, and there won't be anyone to take it away from you. So an example for us in the health department, and you've got your own examples, is adult foster care. We've never had anything to do with adult foster care except maybe if they were in the country and they had a septic tank, and then we'd go out and check to be sure their septic tank was okay. But how these places are managed, how the people who live there are cared for, what the administration and legal authority over these places is, never had a clue. And now these places are, right in the bullseye for COVID outbreaks. One of the reasons for this is they do not have medical personnel. These are family places. They're not like long-term care that have medical directors and nurses who understand universal precautions. These places are, very, very vulnerable. And we've had cases where we've had outbreaks in long-term care facilities, excuse me, in adult foster cares. Oh, and guess what? There's youth in adult foster care. Okay, that's not all adults. We have kids who are very vulnerable and don't have a place to go, a place to belong, who are in adult foster care. Very vulnerable people. And then we've been called, hey, we need you to come get these people out of this adult foster care and get them somewhere else because we're having an outbreak. No idea how to do that, no idea where the sources of care are. And we've had to form partnerships with others and wade into that mess with my staff kicking and screaming and saying, we can't do this. We don't know how to do this. And yet we've had to do it. And we've managed. But that's just an example of something, no training, no experience, no authority, and yet we've had to respond. Another thing that's going to happen is you're going to have to make decisions that you really don't want to make because you're not qualified to make them. And you want help, you want to reach out to others and say, tell me how to do this. You're going to call the health department, for example, and the health department's not going to return your call, but you have to do it. And so what I'm going to say is, look, most of the people on this call really know a lot about COVID at this point. You're the kind of people who read the websites and pay attention to what Dr. Khaldun says. And, you have notes and you have stacks and plans on your, home office table there, wherever it is. And so when somebody says, how long does this person need to quarantine? Or does this person really have COVID? Do they have to isolate themselves? And how long is that? Is it 10 days and 3 days without symptoms or 10 days and one day without symptoms? And you can't get the answer. You need to just go ahead and make the decision because the cavalry's maybe not going to be coming. And we are all experts at this point in time. And we all need to make those decisions. A vacuum of leadership at this point in time is going to leave our community high and dry. And we're all going to have to step up and do that. We're going to have to embrace new partnerships to do this. I mentioned the example of the adult foster care. Well, how did we get those people in that adult foster care to safety? Turns out there was a physician, somebody we'd never worked with, just a really nice person who really cared about those people. And that physician just took it on themselves to figure out where there were beds for these people. We and a local mental health authority arranged for, I'll call them volunteers, they were people working overtime from the mental health agency to come into that home because all of the caregivers were sick. All of the caregivers were isolated at home. There was no one to come in and feed and bathe these people. So we had volunteers come from the community in roles they had never done before. They were mental health professionals, so they were trained clinicians, and they'd been wearing PPE with their own clients who they were meeting with face to face, so they knew how to do that. And they came in and did that. And so these were brand new partnerships we stood up to meet that need. And all of us are going to have to do those kinds of things as we run into new crises. The last thing I want to say is that in everything we do, COVID safety is paramount. It's normal if you read the history of pandemics, whether it's 1918 flu or Marburg virus in Africa or where all the, anytime you read about pandemics, it's usually the authorities, usually healthcare, usually public health, that becomes a driver of this because our instinct is to rush out and take people in our arms and take care of them. And that's how you spread the virus. And so we have to, in everything we do, we have to make COVID safety paramount. Another thing that's happening what we're seeing is we are getting tired, and we are sometimes becoming careless and having meetings that we shouldn't have, or getting sloppy with our social distance and face masking. And we need to make it to the end of this pandemic. We're only halfway through the marathon, and we have to get through the second half. And so we have to practice COVID safety. We have to not add to the problem, and we have to take care of ourselves. And we do know how to do that. We do know how to mask, how to socially distance, not to be around people if we don't need to be around people. And then when we talk about making tough decisions, I do have partners who I've consulted with who have profoundly challenged clients who have to have someone with them face to face periodically. And so then you have to make decisions about the caregivers being in a bubble, so they're not giving their client COVID or getting it from that client because of the client's family. We'll have to make those kinds of tough decisions. So that's what I have to share with you today. And what I want to do at this point is really open it up. I'll just start by asking if there are questions. I do have things I can ask you if that I'm really curious about, but obviously your questions need to be addressed. So you're on mute right now. So if you want to ask a question, go ahead and unmute yourself. Also, you can raise your hand or put a question in the chat box. Leslie Kinney is on this call, and she's looking for questions. And I do see people have put their contact information in there to get slides and the link. So great, glad you've done that. We will save that and get that out to you. But please go ahead and chime in here if you have something you want to address.
Marcus, this is Michelle Seago.
Hi, Michelle.
Hi. I appreciate so much you having this meeting and your transparency. I think we're all feeling what you're describing, and I just appreciate your honesty so much. And with the Department of Health and Human Services, we support you, and we'll do what we can to, come together and be on the same page. We have definitely done what we can internally to have our staff wearing the PPE and, quarantining and all of that. This last week, we have seen an explosion in cases. And so just so that I understand, what is the official protocol? Are we to still report every case to you guys? Okay. So even if we aren't hearing back, you still want us to report, and then we're making decisions about quarantining, even if somebody thinks they're exposed. We're trying to err on the side of caution, even if we don't hear back from you.
Yes, that's a really good question, Michelle, because I want to emphasize the tone of what I'm saying. And I'm not issuing new orders or changing directives. That might happen. We might get new rules from MDHHS about reporting because they're going to try to respond to the current situation. So there might be new guidance coming out about contact tracing. We want to respond to every case. We want to answer every question. We want to do it in 24 hours like we're supposed to. We're actually being monitored, and that's only happening about a quarter of the time right now that we're actually getting to things in 24 hours. And for some things, it's out to 6-7 days. Less urgent things are a week out, which is essentially not responding, right? What I'm sharing is the frustration and the fear, that I use the word promises, that we can't keep our promises, and to encourage you, if you don't get the information you need, that you recognize that we all need to respond and make those decisions on an ad hoc basis. And that if something is different and needs to be fixed later, that's fine. But we really need someone to make a decision. And in case you're wondering, in a pandemic, when it's, human health is at stake, the answer is always the most conservative thing you can think of. So if you don't know whether it's isolate for 10 days plus 3 without symptoms or 10 days plus 1 without symptoms, because that changed somewhere in there and I don't remember where, always go with 3. If you don't know if someone needs to quarantine, you're not sure, the answer is yes, you need to quarantine. If you're not sure if a certain gathering is safe or not, the answer is no, it's not. So that's how we should lean into this thing right now.
Marcus, this is Leslie. I just want to mention too that some of that information is on our website, some of that guidance.
Yes, absolutely. And when we send stuff out, we have handy materials that we'll be sending. Today's not so much about sending out guidance as about having the conversation about how we're feeling and what we're thinking. And I do really want to spend more time listening to you than to me talking or lecturing. Yeah.
Marcus, this is Marie from Caring and Sharing. I have a question.
Yeah.
Okay, so we're in the midst of this in farm country too. My brother-in-law and my son's girlfriend have all tested positive. Do all family members need to be tested? Because I'm sure we've got at least 7 family members with us now, and 2 of them have tested positive. Do the other 5 really need to go? We're pretty sure this is what it is. 2 of them have tested.
That's a really
So
good, that's a really good practical question. And again, there is guidance on that on our website. The problem, Marie, is we have so much guidance on our website. How do you find the answer to that question? That's where you'd really like to talk to a public health nurse. And that's where right now you haven't gotten that guidance, right? So if you're you're in contact with someone who has COVID, you are a contact. And so you're called, you're presumed to be positive. So that means you need to isolate for 10 days plus 1 without symptoms. If you can get tested, it means you need to be tested, but you are to act as if you have it. If you're in contact with someone who was in contact with someone, no, then you don't need to act that way. If you're in contact with someone who had it, who tested positive or was labeled a presumed positive, like a physician diagnosed it, then yes, you need to act as if you have COVID. So, yeah.
Yeah, the whole group is isolated.
Yeah.
Yeah, my husband's been sick for over 2 weeks now, so. Yeah.
Oh my, I'm sorry.
But I have no symptoms. My daughter has no symptoms. I closed our office at Caring and Sharing 2 weeks ago. I didn't close the office. 2 weeks ago, I pulled everybody in, no more home visits, because the cases were going up. And then a week ago, we closed the office. So there's been, the office is closed. People are working from home.
And so I'd like to ask a follow-up question, and I think I know the answer, but obviously this is a time of enormous need for families. And are you trying to think about ways to meet those needs without being able to physically go in?
Yes. We are doing telemed visits with all of our MIHP clients and all of our parenting people. We were doing telemed before, or Zoom meetings. So we're covered there. We also have a couple of our gals are working on our Christmas stuff, which will be a contactless thing for Christmas too. We only have a few families that have applied so far. So we're doing okay.
That's perfect. Yep. Yeah, that's the kind of thing I like to know. Yes.
We have a question from T. Cordes.
Yeah, good morning, everybody. First of all, Marcus, I know that you asked that this meeting not be a public meeting, that it not be posted, but I wonder if we might be able to share the slides with our staff. Let's start with that question.
Oh, yes.
Okay.
And just for the record, I am doing public meetings a lot of times with legislators who will do town halls. And I do want the public to get all of this. Conversations when I'm in the room aren't always the friendliest ones.
Yeah.
So I wanted to have this conversation with you before we try to do it in another setting.
Yeah, Marcus, I can relate to conversations and interactions not always being friendly. You know, COVID fatigue is taking many forms. And I have been super, super, super conservative. If I'm not sure of the answer, go away and isolate or quarantine. What would be helpful to me, and your staff might already be doing it, but on the occasion that anyone here might be able to get through by telephone, if you could just back us up that those of us on this call, we probably know an awful lot about COVID, that we are, and so we're making decisions from a pretty solid base of experience at this point, that where decision makers are unsure, they're making decisions, and to respect those decisions based on the base of knowledge, you know, and so forth, just offering that support, because we do get people who you know, just want to fight things. And all we're trying to do here is keep people safe. But some people feel picked on. You know, that's the COVID fatigue and questioning decisions and authority. So it just some backup for us on that. You know, even lie a little and just, you know, heap praise upon us. That would just be very helpful. So
Yeah, so I know what you're saying. You need something in writing with the health department letterhead.
no,
Because,
not even that, Marcus. Not even that. Just if somebody gets through by telephone,
oh,
and
okay.
they're wanting to verify a decision we have made, just you know, we're all using our best judgment, and
Oh.
your leaders have really educated themselves and know quite a lot about this, and safety is paramount, even if we need to be ridiculously cautious. So that's the kind of backup we need.
Oh, Tracy, that is really good, because I don't know that we've actually instructed our virtual phone bank on that specific thing. So, you know that under MyOSHA, you must protect the health of your employees and coworkers, things like that. You have the authorities you need, but I don't know that we've actually told our phone people, Tracy Cortez, if someone calls and complains about her, you need to say she's your employer, do what she says, or whatever the situation
Well,
is here.
not even the, you know, authoritarian kind of thing, just, you know, we support the decisions she's making
Yeah.
because of the extent to which she has educated herself. So Marcus, that we, you know, the court administrator and I are here making decisions about this stuff every single day.
Yeah.
So that kind of backup, just, you know, they've educated themselves. We trust their judgment and think that you should also. So that kind of thing.
Wow. Okay, that's perfect. Thank you so much.
Hey, Marcus, this is Rich Romero, St. Louis PD. I do have a question as well.
Okay.
As far as public safety response, law enforcement, medical, fire, et cetera, the information here at Gratiot County, we are allowed to have under the statute as far as responding to a COVID positive location. How often, or I guess, what are the rules and protocols for the testing procedures to notify the health department? We've had multiple times here, most recently for us, going to a residence here last week, that we get there and the people meet us at the door. Our guys are doing everything possible to have people meet them at the door, come outside if they can, and whatnot for those precautions. But we have people that meet us and they're showing us paperwork, or they're telling us that they are just got done testing, they got their results, they're positive. This one house in particular, we had 2 people positive in. At least that's what they're telling us. They showed us a paperwork where they got discharged and they're to be in quarantine. So we rescheduled the things that we were trying to do with them. But we've had that on more than one occasion. I think, our dispatch is, the health department here is getting, the information they can, but what is the requirement for that to go out? Because we are finding occasions where it's not just people telling us they are because they're trying to evade whatever we're trying to do, but they actually have the proof showing something is done there. What is the requirement there for the testing facilities, or whose responsibility is it to share that information with our health department to get that to first responders?
So we still have our procedure in place where on the day that we learn about a case, we do send that information to dispatch.
Mm-hmm.
We've stopped it in Clinton and Montcalm because there's so many cases they just said we can't handle the flood of information. It's too much information. So Gratiot is still doing that, last I heard. So you should have the last thing that we know about. but you're starting to see that system breakdown. So it's coming so fast and furious that we don't even know about all the cases now, right? So we're sending you what we know, but these people are getting tested somewhere where the lab system is broken. They had a rapid test and it didn't get manually data entered, so we might not know about it. And part of what I'm saying is, you can notify us, but it's going into the work pile. So we'd appreciate you trying to tell us if you know, but I'm alarmed about where we're at. Because it's 4 weeks ago it was working. 4 weeks ago, we were getting all the information from the labs. The rapid tests weren't happening. 4 weeks ago, this person would have already been called by us before you got there. And now 2-3 days are going by and they're still not hearing from us, on what they're supposed to do. So that's what I'm letting you know, Richard, that it's really tough right now. We would appreciate if you tell us everything you know, and we will try to do the same.
Yeah, and that's what I've been doing. Like with these last couple, I would contact Dan Morden, our director of dispatch, and then typically it's Haley Brewer because I'm familiar with her. And I would just pose a question. We were notified of a positive at this address. Do you know about it? And it's either yes, we do, no, we don't. We haven't gotten any information yet. Sometimes there's follow-up when we do get a response back. Maybe it's a day or two later, but we're starting to notice it a little more. So yeah, you're right. Maybe it is just because there's such a mass of them. But I just wanted to make sure that that was still in place, that these testing facilities are supposed to be notifying you guys that we have positives wherever they're at.
Yeah, we'd appreciate it if you have time. Yeah.
Okay, thank you.
Yeah, I mean, Richard, I'll just add, Gratiot County for so long was such a low spot in terms of the amount of COVID. Whenever you'd have an outbreak, it was in a long-term care facility, and they would snuff it out. And we look, to the east towards Saginaw, to the north towards Isabella, south towards Lansing, and we were like, when is it going to hit Gratiot County? And unfortunately, it's hitting now. And the little peaceful bubble is popping.
Marcus, should we be recommending to people that we would prefer they not get a rapid scan, that we would rather have them doing testing that is entered into the database, or is that not significant?
So the rapid test is useful for screening. So it's it's useful for places like long-term care facilities, adult foster care, jails. If you had a business with a lot of employees and they thought maybe something was going on and they wanted to do an assessment, and then identify people who might be positive, because with the rapid, you have to follow up and get a confirmatory test. So it's that kind of setting. So the problem for just an individual who's just curious about their COVID status is you get the rapid test, and whatever the result is, you then have the problem of, well, to really be sure, I have to have a confirmatory test. So I would encourage people to do it where you need to do. So one of the things, Penny, that's coming is schools might start saying they want, weekly rapid testing of all school personnel. That's a shoe that could drop here in the not too distant future. And they would, they would dump those tests on you and us. And they're really easy to administer in a world where nothing is easy to administer. These are, just adding to the pile of reasons to think it's getting too hard. But that's an example of something that might happen for surveillance. And then the problem is, all your positives have to go for confirmatory testing. So I know Jake is on the line, and he's curious about when those things are going to drop. And Jake, we don't have an answer to the question about CLIA yet, but we think in a couple days they'll start arriving. So I'll be getting in touch with you, Jake.
Marcus, there was a question asking if the rapid tests are as accurate, so hopefully you've answered that question.
Yes, and this is where it would be beneficial to have Dr. Morris instead of me, because I'm an administrator, I'm a bureaucrat, I do personnel and contracts and legal, and Dr. Morris would be able to tell you exactly how inaccurate, when, and I can't do that. What I remember is that for positive rapid tests, you must follow up with a confirmatory PCR test. That's the swab up the nose test.
Many of those rapid tests we're seeing, Marcus, from people that have had them done, they come back inconclusive. And so then they have to go for the full, the regular swap, and then they're coming back positive.
Right.
We see
When
a
you-
lot
when
of
you- Sorry, Marie, when you hear people talking about, I had a false positive, that should not be referring to the PCR test, the swab up the nose test. That's referring to the rapid test. And so it doesn't mean you're okay. It doesn't mean you shouldn't act like you have COVID. And again, always erring on the side of being conservative. You don't say, oh, well, you had a rapid test that was negative, you're good to go. No.
Marcus, what's
Yeah.
the capacity in our county in any of the counties for getting the rapid tests processed in a timely manner?
I am uncertain. We know there are clinics that are offering those. I don't think those are on the state website. So if you go to michigan.gov/coronavirus, you can search for a clinic near you that, doesn't require insurance, that is for people who are asymptomatic, all of the problems we've been having. That website for what's on it is now a lot more accurate than it used to be. And there's more PCR testing available in the community. We do not have a list of where the rapid tests are available because physicians are just pulling them down, faster than we can even find out about it.
Well, we're struggling because even with contracts with the local hospital systems, they're out 96 hours on testing. So we're losing staff rapidly, and to be able to continue to provide an essential service is going to be a continued struggle when we don't get prioritized as a behavioral health provider for testing and turnaround on those results. So it's a struggle, but I appreciate the meeting. We have our own internal pandemic planning team meeting at 10 a.m. and we have lots to discuss today. So we're continuing to do our own internal contact tracing and doing everything we can to prevent the spread. So thank you, Marcus, for this meeting.
Yeah, let me just say, you know how bad I've been about follow-up, Tammy, because of all the work, but I think that's a really good point about rapid tests for community mental health. We're going to get a bunch of these things. What you really need is a continuous pipeline, because we've been told that after we get ours, we won't get any more for a while. And we already have people we need to share them with, but I think we have some left over, and I'll try to follow up and see what we can do, because your setting, as far as surveillance or screening, is the kind of place where it could be used.
Well, and if they're going to want to expand it to all group homes, they've got to expand capacity for testing. Because they have it for the larger group homes right now, which we only have one that we're dealing with. But if they're going to expand it to all homes, and it's going to be impossible to do with 96-hour turnaround.
Well, and they're talking about expanding the rapid tests, which should be, half an hour or 15 minutes. Again, with the problem that you have to follow up with PCR, and we don't know how they'll process all the rapid tests or how we'll respond when we find out we have 5,000 people in adult foster cares who could be making their neighbors sick. We don't know how we'll respond to that.
Well, I will say it's the staff that are bringing it in the homes, not the individuals. But thank you, Marcus.
Okay.
Marcus, we've got some more questions. Jennifer Tubbs has her hand raised, and I would ask if you could lower your hand once you have your question answered. That would be great.
Did Jennifer?
Hi.
Yeah.
Hi, Marcus. Thank you for having this meeting and including us. Watertown just faced where we've been able to keep our staff COVID-free until the election. And then the election that just took place, we had our first township employee test positive, and we are awaiting 2 other results from that. And also it has also led to the one employee that we have going to their family also being positive. What I'm curious about is we automatically quarantined all of our staff after working the election, just because they came into contact with 2,000 plus people on that day. But we do know we had a small amount that came through without masks. All of our employees were in N95s with visors behind plexiglass. We took every precaution we could, and we still got it. So my question to you would be, if if you are finding out that there are more people than we are aware of from actually voters that day, is there any way for the township to be notified? Because we could participate in, it would be difficult, but we could isolate how many people were in person versus absentee ballots and get information out to the entire township. What we did do was post on our website and post on our door that we ended up closing the building too for 2 weeks we'll reopen to in-person contact on November 18th, but we posted it was because of transmission at the election, so that people would be aware in the communities they saw that, and hopefully, hey, I voted, I need to stay home. But if the health department is getting notification that there were more voters and they did vote in person that day, would the township get any notification of that?
So the situation is that that's the kind of thing that I can no longer promise. So you know that Becky Stoddard is aware of this situation.
Right.
She's doing contact tracing, and now she's of course supported by many other people who are working with her under her guidance. They're trying to follow up with everyone they can. Voting should come up during the contact tracing. It should be something that they should note. I will make a point of asking that, just to be sure. But the dilemma we're facing is the system breakdown. And there are so many people waiting for follow-ups with us that this is where I think your response to quarantine people automatically, and not wait and not assume that, Becky's going to tell you everything, is exactly the right kind of response we need right now. But I will, and for all of our townships, I mean, you're not the only township that had positive poll workers after the election.
Okay, well,
It's a problem.
it is a problem, but if we need to contact all of our voters, you let us know and we'll make it happen.
Yeah.
Marcus, we have a question from Lisa Lund. She says, because of the increase in testing, are tests at local medical facilities still being done for those who were exposed, not showing symptoms, or just for those showing symptoms?
By local medical facilities, Lisa, do you mean long-term care and skilled nursing? Because that's still happening. Hospitals are still doing that. Unfortunately, we're aware that physicians, oral health care providers, and some others are inconsistent. So you need to decide how much you trust your own primary care doctor right now. I hope that's helpful, Lisa. Leslie, do you think I missed the question there a little bit?
I think she maybe was just talking about hospitals and other testing sites, but I think you answered it.
Okay.
We are hearing, Marcus, that there are, from our employees, because we have a large number of employees in our organization, and we're hearing them say that a lot of physicians and healthcare sites are not testing unless you're showing symptoms or have a doctor's statement.
Oh, okay. That does make sense to me. Yes, we think that's a problem, and it's another sign of system breakdown. Dr. Morse is fighting with everybody she can find. People are cavalierly saying, well, I'm an essential worker and, I can work. And our point is that that's a rule for sort of emergency situations. It doesn't mean it's safe. There's a difference between what's safe and what you must do because it's a crisis. And that nuance isn't there. People just want to follow rules.
Marcus,
Yeah.
I think the question is, when people go get tested, testing sites are turning them away, saying you are not symptomatic, we are not testing you. They're asking if that is truly the case.
So that should not be the case right now. The last time we checked with some of our local testing sites, that was not the case. But if you look at the headlines, most recently, testing shortages seem to be coming back, and then that will become the case. And so we're worried about that. And it may have already happened and we just don't know about it.
Marcus, Ken Lowndes says, I'm curious about the community messaging regarding the October 29 epidemic order. On the infographic, it reads, employees who can work from home must do so. He wants to know if this message is still getting out.
So it's variable, and it depends on the attitude of the employer. And some are very strict about it and some are not. And we get complaints and we try to follow up. And some people are compliant with our follow-up and some are not. Sometimes we have to escalate it, to the licensing agency and threaten that employer. So it's a battle, Ken. It really is. Yeah.
Marcus, this is Terry from United Way. Can you talk about the current capacity for the local hospitals? Is that an issue that we need to be concerned about?
Yes, it absolutely is. Today, as we've been meeting, there was a big announcement by hospital administrators that they are at capacity and they're begging the public to change their behavior. Spectrum has already done a wonderful presentation on their crisis of capacity. We know that Mid-Michigan has been very transparent about sharing their issues. The one thing that will be different this time around is that the hospitals to a certain extent have hardened themselves and they have emergency plans for adding beds and things like that. So there's some extra capacity in the system that wasn't there before that will keep it from getting really horrible. The one place that maybe we're wrong is with staffing. Do they have the capacity to add staff and extra shifts? How long can somebody work? I know at the health department, our most forward-facing nurses right now are basically 12 hours a day, 7 days a week, and they've been that way for weeks. And we assume that it's been pretty similar in the hospitals. And how long does that last? To finish a marathon, you have to slow down at some point and coast. You can't run at full speed all the way to the end of a marathon. So that's what we're really worried about.
Are small rural hospitals housing COVID patients? Or are they still transferring them to Lansing and Grand Rapids?
No, they're housing,
Okay.
definitely. And in fact, we are seeing the situation where they're shifting COVID patients as they need to balance the load. That's happening too. And that's going to need to happen. That's going to be part of the normal operation of the system. Yeah.
Okay, thank you.
Marcus, we have another question. This person wants to know, have there been any attempts at enforcement using the public health law? This person is curious if enforcement attempts have been made and ignored or simply have not yet been attempted.
So what has happened? So the most public spectacular case that you're aware of is with a certain gym in Greenville. And that gym was different from all other gyms because all other gyms that were open illegally were bending over backward to be safe. Although a few of the owners misunderstood what safe meant, they were trying, they were working with us. And they had, low volume. And so we wanted to keep our powder dry and look for egregious violators. There was a gym that was publicly announcing they were taking no safety precautions. And so we cited them under the public health code, and lawyer Neil Kalman, who got the Owasso barber off the hook, came to town and said, I'm going to sue you to kingdom come, and you're going to be in court and you're going to spend, tens of thousands of dollars. And at the end of the day, you're going to get thrown out on a technicality. So that was our effort to use public health orders. And that was what happened at that time. Right now, we don't have anything else that rises to that level of egregious violation where we think someone is deliberately placing the public at risk. We would try again, but it might end equally badly. And this is part of the dilemma that we're having, where we have, divided leadership, where half of us leaders are saying COVID is real, wear a mask, take precautions, make your people exercise outdoors, not indoors, whatever it is. And we have half of our leaders saying, no, you don't need to wear a mask, it's not real. And so we're not united as a community.
Marcus, along that same line with that particular question, is there any recourse for those that we know are blatantly violating the quarantine time period that has been recommended to them as far as that 2-week period?
There are. It's complicated, unfortunately. That's one of the problems the state is having. is they used to have emergency orders. All the orders were in one place. You could go to that website and look. So now if it's a food facility, their license is Department of Ag. If it's a different kind of place, it's LARA, Licensing and Regulatory Authority. If it's it could come to public health, it could come to the local law enforcement. And so it's very complicated. So we would always like to hear those complaints, and we will try to turf them to the right place. But it's complicated. Anybody who's an employer, you can always try Occupational and Safety and Health Administration. On their homepage of their website, you can find a link to report. Unfortunately, the link makes it seem like only employees can report. And they tell us over and over again, no, this is a pandemic. Anyone can report. They haven't fixed their website, but go ahead and report them. They're going after big places first. They're ignoring.
I was thinking more of employees, like when we have quarantined employees and we know that they're out, we've seen them out and they're supposed to be in quarantine. Is there any recourse there?
We're not going to fill our jails with people with COVID, unfortunately. So as an employer, if you want to discipline them, that would be an option for you, but we're not going to ask the sheriff to set up a COVID wing in the jail,
Thank you.
Marcus, Sheriff Williams would like to know if you can touch on the latest vaccine news.
Oh, yes. This is very, very important. And so what you're hearing is basically true. We have a candidate vaccine that seems to be effective. It's coming sooner rather than later. Possibly around Christmas, otherwise right after. The situation we're facing is not that there won't be vaccine. Oh, the other piece I should add is more than we thought. We thought we were only going to get a few thousand doses at first. We're expecting many tens of thousands of doses. Okay, so we thought this was going to, it would be till summertime, till you had a chance to get your shot. And now we think it's going to happen sooner. Here's the situation. The two groups of people that can give this shot are healthcare providers, especially hospitals, and public health. And this is happening at the worst possible time. It's going to be happening at a peak of COVID, where it's twice as high as it is now. And this is what we were afraid of. So we're scrambling and we're talking to the state as much as possible about how do we pivot from what we're doing right now to take care of people and move to getting the vaccine into other people's arms. It was pretty easy to stand up volunteers to help with the contact tracing. There's a virtual call center across the state where volunteers are, they're working in your counties right now, helping us with the contact tracing. People who are licensed to give shots, a heavier lift. People who can do that work day after day for days on end. Where do you find that pool of volunteers? So pivoting to being able to get the vaccine into other people's arms, this is really about finding the people right now, Mike. That's what we're trying to figure out in partnership with the state. Okay, I have about 5 more minutes and then I have to take a break.
Would our school nurse be able to administer a vaccine to our employees?
Most likely you'd have to, she'll know if she's certified, and that would be a great question. Jail nurses, same thing. There are these little pockets of people that have the ability to do a little bit, and we're going to have to stitch that network together in order to get this done. So,
Penny, are they RNs?
Sorry, yes, we do have an RN. A few of our school districts in Montcalm County contract with Spectrum Health for their nursing services. Not all of them, but I believe most of them. So we do have RN and especially the ISD, we have an RN on site through Spectrum Health contract services.
Yes, they would be able to provide the vaccine. Same thing with EMS providers and jail nursing staff too.
Thank you, Haley.
You're welcome.
yeah,
Hey, Marcus.
Okay, I was just going to say, we've already had EMS that have reached out to us to be part of the solution. So I'll take one more question. Leanna, you haven't asked a question yet, and then I'll have to.
So
I'll have
my
to transition.
question for you, it's kind of adjacent. Your health department still has to function as a health department, which means you have all these other things that are going on as well, at least to some extent, outside of COVID. As community partners, is there anything that we can help with and help kind of take some of that burden away to free you up for COVID?
Yep, that was my message.
And
That's
what do
you
you
can
want
help
us to
us
help
with.
with?
And the help is make decisions. Be strong, act like you're public health and you know the answer. That's what we need you to do. We've already stopped doing a lot of other things. And some of it is with permission from the state. They've said, yeah, you don't need to do this or that or the other program now. Some of it we haven't stopped, like WIC, because it's sustaining vulnerable families at a time when they need it. Other things we've stopped doing, and the state has told us, no, you need to stop, and we just stopped anyway. So we're doing what we can ourselves, but the thing that we need is for all of us to act like a public health family and make those decisions locally. And like I said, if it needs fixing later, we'll fix it. But yeah, that was my message, Leanna. Thank you for asking.
So as we're working with families and we have questions that we would normally send to the health department, first thing first, go to the website, see if there's a page we can download, print it off and get it to them instead of filling up your phone lines.
And then put it in your notebook on your desk.
Right.
So it's a procedure for you.
Okay.
And 211 is the COVID hotline for the entire state of Michigan. Refer your people to 211 if they have questions.
Marcus, I would also like to add that if our community partners could help us reinforce our message, main messages being to the community, wear masks and social distance, that would be very helpful.
Absolutely. Okay, I have a feeling that we could have this conversation a few more times. I've promised you many times we would be having it locally with the 3 county collaboratives, and obviously that needs to continue to be a priority for me if I can do it. So hopefully we'll be convening again at a county level. So fabulous questions. Thank you so much. I'm sorry to have to sign off when there's obviously still interest, but I'm carrying the same message to the local media here in a few minutes. So thanks, folks.
Thanks very much, Marcus.
Thanks,
Thanks,
Marcus.
Marcus.
Good luck. Good luck as you share with the local media. We
Yep.
are behind you.
Thanks, Marcus.